year was 1924. Eben Byers had everything: wealth, status, a thriving steel empire. Then someone handed him a small bottle of radium-infused water. The salesman promised it would make him feel 20 years younger. Byers drank 3 bottles every single day for 2 years straight. By 1932, his jaw had completely disintegrated. Holes riddled his skull. His brain was collapsing. When he died, his body was so radioactive they sealed his coffin in lead. 70 years later, his bones were still hot with radiation. The cure had turned him radioactive. This is medical history. And what happened to Eben Byers happened to thousands who trusted their doctors and paid with their lives. December 14, 1799. George Washington woke with a sore throat. 3 of America's most respected physicians arrived and knew exactly what to do. They opened his veins and drained his blood. Over 12 hours, they drained nearly 80 ounces, 40% of his total blood volume. His lips turned blue. His voice became a whisper. By nightfall, he was dead. One physician later admitted they might have overbled him. For over 2,000 years, bloodletting was the go-to treatment for everything. Fever? Drain the blood. Infection? Drain the blood. The theory? Disease came from imbalanced bodily fluids. Too much blood caused inflammation. The solution seemed obvious. Physicians used spring-loaded lancets and leeches, sometimes dozens at a time. France imported 40 million leeches annually just for medical use in the 1830s. The practice seemed to work because patients with high fevers would improve after bloodletting. What doctors didn't realize, they were inducing shock. The body, deprived of blood, would lower heart rate and appear calmer. Internally, organs were starving. Immune function was collapsing. Thousands died from the treatment rather than the disease. Lord Byron was bled repeatedly in 1824, losing over 2 liters in 10 days. On his deathbed, he said, "You're killing me." He was right. The liquid looked like liquid silver, rolling beautifully in its vial. Doctors called it quicksilver. For 4 centuries, mercury was medicine's most potent weapon. Prescribed for syphilis, tuberculosis, depression, even teething pain in infants. They were administering poison. Mercury binds to proteins, disrupting cellular function. It accumulates in kidneys, liver, and brain. Symptoms: excessive salivation, tooth loss, tremors, personality changes, kidney failure, death. Hat makers used mercury to cure felt. They breathed vapor daily and developed uncontrollable tremors and hallucinations. The phrase "mad as a hatter" was medical observation, not invention. For syphilis, the treatment was barbaric. Patients were placed in hot rooms, given mercury pills, or subjected to vapor fumigation to induce salivation, up to 3 liters per day. Mouths became ulcerated. Teeth fell out. Jawbones deteriorated. The grotesque irony, it seemed to work. Syphilis lesions would disappear after treatment. What doctors didn't understand was that syphilis naturally cycles through dormant phases. The disease wasn't cured, it was hiding. Meanwhile, mercury was causing permanent damage. Abraham Lincoln took mercury pills for years for melancholy. He stopped in 1861, noting they made him cross. Modern analysis suggests chronic mercury poisoning. An archaeological site in Peru yielded over 800 skulls with deliberate holes carved while the person was alive. Trepanation is humanity's oldest surgery, dating back 10,000 years. Ancient Peruvians had survival rates between 50 to 90%, matching or exceeding American Civil War surgeons with steel scalpels. Without anesthesia, surgeons used sharpened obsidian blades to cut scalp, then scraped away skull bone. The patient remained conscious. The process took hours. What? Ancient cultures believed spirits caused seizures, headaches, mental illness. Creating an opening would let evil entities escape. But for some conditions, head injuries causing blood pools pressing on the brain, it might have actually helped, creating a dangerous feedback loop. The practice spread globally. Medieval European physicians performed it for epilepsy and migraines. By the Renaissance, surgeons had specialized tools. But better technique didn't improve outcomes. Without sterilization, infection was almost guaranteed. Even survivors often died from meningitis. During the French Revolution, trepanation was promoted as a cure for revolutionary fervor. Physicians suggested extreme political views came from brain pressure. The treatment? Drill it out. Walter Freeman liked to perform 2 lobotomies before breakfast. He'd arrive in his lobotomobile and work assembly line fast. 10 minutes per patient. Ice pick through the eye socket, wiggle it around, pull it out. Next patient. Over 2 decades, Freeman performed approximately 3,500 lobotomies. It started because Antonio Egas Moniz won the 1949 Nobel Prize for developing the procedure. The theory: mental illness resulted from overactive brain circuits. Disconnect those circuits, eliminate symptoms. Freeman's innovation made it worse. No drilling, no surgical theater, no anesthesiologist. Just an ice pick and confidence. He performed lobotomies in hotel rooms and kitchen tables. Patients rarely consented. Many were institutionalized with no legal say. Others were children deemed too difficult. One patient was 4 years old. His symptom? Temper tantrums. Rosemary Kennedy underwent lobotomy at 23. Her father arranged it without telling his wife. The surgery left her permanently incapacitated, unable to speak coherently. Many patients lost personality and emotional capacity. They became docile but empty. Hospitals loved it. Lobotomized patients were easier to manage. Freeman remained convinced of his genius until 1972. The bitter irony. Moniz was shot by one of his lobotomized patients in 1939, paralyzing him. The cure created its own victim. Emergency kits hung along the Thames River. Inside, a brass syringe, rubber tubing, dried tobacco. Instructions: in case of drowning, insert tube. Administer smoke vigorously. For nearly 100 years, tobacco smoke enemas were official resuscitation technique. The Royal Humane Society installed these kits along the river. Volunteers were trained. Physicians endorsed it. Medical journals published papers on proper technique. The theory: tobacco smoke blown into the rectum would warm the body, stimulate intestines, and shock the cardiovascular system back to action. Used for drowning, headaches, hernias, cholera, typhoid, anything. Occasionally it appeared to work. If someone wasn't actually drowned but in respiratory distress, the physical stimulation might cause them to gasp or cough. Observers interpreted this as smoke reviving the dead, creating powerful anecdotal evidence. By the early 1800s, doctors discovered nicotine was toxic to the heart. The practice was abandoned by the 1840s, but it left a permanent mark. The phrase "blowing smoke up your ass" comes directly from this practice. The tobacco enema kits remained along the Thames until the 1870s, with occasional use continuing into the early 1900s in rural areas. The Radium Girls painted watch dials in factories across America. To create fine lines, they were instructed to lip point their brushes, put the tip in their mouth and create a fine point. The paint contained radium. Management assured them it was harmless. The women began glowing in the dark. They thought it was magical. Some painted their teeth for fun before dancing. Within months they got sick. Grace Fryer's teeth fell out. Her jaw swelled. Pieces of jawbone came away. Dozens developed jaw necrosis, severe anemia, tumors. Catherine Wolfe Donahue died in 1938 at age 35. Her body so radioactive it's still dangerous. Companies denied everything, claiming syphilis. They fought every compensation claim. The legal battle took years. Grace Fryer died in 1933 at age 34. Meanwhile, radium had become a health craze. Companies sold radium water, toothpaste, cosmetics, suppositories. Advertisements promised energy, improved sexual function, younger skin. Eben Byers started drinking Radithor daily in 1927. He felt fantastic. By 1930, his jaw was disintegrating. X-rays revealed holes throughout his skull. He died in 1932, weighing less than 100 pounds. A Wall Street Journal headline, "The radium water worked fine until his jaw came off." In 1965, scientists exhumed Byers' body. Still dangerously radioactive. Radium's half-life is 1,600 years. The people who consumed it remain radioactive long after death. In 2025, we look back at these practices with horror. We wonder how educated people could have been so catastrophically wrong. But here's the terrifying question. What are we doing right now that people in 2125 will view the same way? The doctors performing lobotomies thought they were helping. Physicians prescribing radium believed it was safe. They were all wrong. Catastrophically, fatally wrong. And statistically, we're wrong too. About something. We just haven't figured out what yet. Consider chemotherapy, poisoning the entire body to kill cancer, hoping the cancer dies first. Or psychiatric medications prescribed to millions, including children, for conditions we don't fully understand. Or cumulative radiation from CT scans. The pattern is clear. When doctors don't understand a condition, they treat it anyway. Because doing something feels better than doing nothing. George Washington's doctors bled him to death trying to save him. They used the most advanced medical knowledge of their time. They failed catastrophically. Are we any different? We have better tools, more knowledge. But we're still making our best guess, hoping we're doing more good than harm. These practices, bloodletting, mercury, trepanation, lobotomy, tobacco enemas, radium, were all performed by educated professionals. All supported by institutions, taught in medical schools, published in journals. All considered normal, standard, accepted practice. Until suddenly they weren't. History doesn't repeat, but it rhymes. The rhythm, confidence, widespread adoption, emerging doubts, mounting evidence, eventual abandonment, then horror. We're somewhere in that cycle right now with dozens of current practices. We just don't know which ones. The only honest conclusion is humility. Medical knowledge advances, but it's never complete. What we know today will be revised tomorrow. Medicine isn't steady progress toward truth. It's trial and error with human bodies as the testing ground. The blood of George Washington was drained by confident doctors. The jaw of Eben Byers rotted from radium he believed was medicine. The minds of thousands were destroyed by Nobel Prize winners. What are we so confident about today that future generations will recoil from? We won't know until it's too late. Until the damage is done. Until the bodies are counted. And then we'll move forward, confident again that this time we've learned our lesson. Until the next catastrophe. The history of medicine is a graveyard of good intentions, paved with the bodies of patients who trusted their doctors to heal them. And somewhere right now, a doctor is prescribing something that will one day be looked back on with the same horror we feel about lobotomies and radium water. Every generation believes they've figured it out. Every generation has been wrong about something. We're no different. We just don't know it yet.